This nursing mindset is about infant through adolescent development. When nursing students first learn pediatric development, it's often easy to think the goal is to just memorize developmental milestones and Erikson stages. While that's important, let's think about what our true nursing mindset is. As nurses, we don't want to just memorize development just to pass an exam. We actually have to think about how we're going to use it to individualize our patient care. So let's look at what this means. Let's first start with infants. Infants are developing trust. They learn whether the world is safe based on how consistently their needs are met. As nurses, our role is to help build that trust by providing comfort, minimizing stress, and partnering with parents whenever possible. We also focus on health promotion through safe sleep practices, immunizations, nutrition, and parent education. For toddlers, they are learning independence. Everything becomes, I can do it myself. As nurses, we should encourage that independence while keeping them safe, offer simple choices whenever possible, allow them to participate in their care, and remember that toddlers have very little awareness of danger. That's why injury prevention becomes one of our biggest priorities. For preschoolers, they are developing initiative. They are naturally curious and learn through imagination and play. One of the best things nurses can do is use play to explain procedures and reduce fear. Something as simple as letting a child hold a stethoscope or place a bandage on a stuffed animal can make the healthcare experience much less frightening. For school-age children are developing a sense of success. They want to achieve, participate, and feel capable. As nurses, we should recognize their accomplishments, encourage participation in care when appropriate, and provide positive reinforcement. Building confidence is just as important as treating the illness. Adolescents, they are developing their identity. They're asking questions like, who am I? Where do I fit in? This is why privacy, respect, and non-judgmental communication are so important. Always include adolescents in conversations about their care, speak directly to them, and create an environment where they feel comfortable asking questions. Now let's look at the big picture. So let's look across all 5 stages. The child's developmental needs change, which means our nursing care must change too. Notice that we're not providing the same care to every child. Instead, we're adapting our communication, teaching, and interventions based on where that child is developmentally. That's what patient-centered care looks like. Here's the one idea I hope you remember. Developmental milestones tell you what the child should be able to do. Erikson helps you understand what the child needs emotionally. Clinical judgment helps you decide what you should do as the nurse. When you combine all 3, you're no longer just caring for a child based on age. You're caring for the child as an individual. And that's exactly what great pediatric nurses do. Keep developing your nursing mindset.